Durham Region. The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers nor Rogers TV.
The COVID-19 pandemic has stretched our healthcare system to unbelievable levels. Healthcare workers continue to put their well-being and their lives on the line. And no one knows that better than Dr. Craig Donaldson, a physician and staff at Headwaters Health Care Centre in Orangeville. Donaldson is also a former Oshawa General, and he joins us now. Craig, how are you?
Good, John. Thanks for having me on.
Yeah, well, thanks for taking time out of your busy schedule. So first of all, Craig, can you let us know what part of the hospital that you work in?
So I'm up at Headwaters Health Care Centre in Orangeville. We're about a medium-sized center, and I'm a full-time physician in the emergency room there.
Oh, wow. So you're right in the thick of things in the emergency room, right?
Yeah, that's where all the actions happen. That's where the rubber meets the road.
So can you tell me what it's like? We're about a month and a little bit into this pandemic. What has you seen change in the emergency room from, say, the beginning of last month?
Well, it's an interesting story because like everybody in society, doctors and frontline workers were dealing with the uncertainty of what should we do? What are the guidelines? How do we need to modify? How are we going to protect ourselves? How are we going to protect our families? So there's a lot of uncertainty, a lot of theories, but we worked together really well at Headwaters. So we came up with our PPE plan. We came up with all of our new medical directives of how to deal with such a pandemic. And it's worked out really well. So luckily, volumes are overall down, but of the people who are coming in, they're the really sick and those with COVID who really need evaluation. So it was stressful at first, and it still is a little bit stressful. But it's a high stress environment to start with, and when you add in pandemic and precautions and all those extra layers to think about while you're trying to do the difficult job as is, then it did make it a stressful environment, and you had to just adapt on the fly and use common sense, and our team really did well of coming up with a common sense approach.
So let's say I'm sick and I have to go to the hospital. What's something that you would want people to know before they actually try to walk in through the doors?
So I think number one is, if it's an emergency, it's an emergency. Come in. We're open. Okay. If it's something you could try calling your family doctor about and just discussing with them beforehand, it's a good way of triaging, and maybe based on them knowing your past medical history and similar presentations in the past, there are ways to video conference, and they can do a reasonably full assessment, just like we're talking right now, at the convenience of your own home, and that might mitigate you needing to come in. But that being said, if you have symptoms that you feel it's an emergency, please come in. We're available. We'll take you in. Nobody's going to give you hassle, that's for sure.
Is there any protocol or PPE that people should wear if they were coming to the hospital?
I would recommend everybody should probably put on some form of a mask. That would be very beneficial. If you don't have one, no problem. We have screeners at both of our main entrances, and you can't get into the hospital any other way. Everything's shut down, and everything goes through those two main entrances. So you will be met with a screener. They will ask you symptomatology and if you've had any contacts. And they will provide you with hand hygiene, they will provide you with a mask, and they will direct you to where you need to go.
Now, what about your own safety and the safety of your colleagues? I mean, clearly you have your own PPE protocols in place, but are you feeling safe during times like this?
I think so. Emergency staff, emergency doctors, and physicians in general are well trained in PPE. There have been other previous pandemics or concerns or outbreaks in the past. We all learn about this in medical school. Nobody thinks there's going to actually be a full-blown pandemic in their medical career. I can say that for certain, but we know how to kind of get back on the horse and make some modifications. So yeah, we're good at maintaining PPE vigilance. We're good at donning and doffing. That's taking on, putting on the PPE and taking it off in the proper way, doing proper hand hygiene, and identifying high-risk cases and high-risk procedures that you might need to go in a little bit more protected for.
Now, you talk about the physical of washing your hands and wearing masks, but what about the mental state of yourself and your workers? You working in an emergency room must be, well, you said it, it's stressful even without a pandemic. With the additional layer of something like this, how are you guys dealing and coping?
Well, I think the emergency room, the camaraderie amongst staff is pretty high. And I think for some of us, it's almost been therapeutic in going and, commiserating with fellow staff and our kind of unique sense of humor that we have. It's also kind of a bonding experience because, the team we have at Headwaters, I wouldn't want any other team behind me. They're as medical teams go, they're top notch. Right from our chief of emergency, Paul Scotton, to our nursing staff, our cleaning staff, our respiratory therapy and anesthesia department, who have been supporting us in a fantastic fashion, going above and beyond. So I think knowing that you're part of a team and part of a team that is committed to doing this thing the right way and doing it together, it kind of makes you relax and, just roll with the punches and use common sense and the best evidence that you have available at the time.
Mentioning the team mentality, is there anything that you learned from your hockey playing days that you're putting forth and putting into action, maybe even to boost morale?
I would say 100% yes. I've always been a believer is that you can't perform if you're nervous or uptight. So I've definitely brought out some of my old dressing room tactics of being able to keep a dressing room loose, keep the jokes going. We treat everything serious, but you need to be relaxed. You need to roll with the punches. You need to just identify what the job is that needs to be done and do it with modifications or without.
Now, you were a young hockey player. There also seems to be a influx possibly of younger people who are contracting the COVID-19 virus. Has the age of patients changed over the last few months, or is it predominantly seniors? What have you noticed?
I think the people who are younger, healthier, and don't have any other real medical issues that would put them at higher risk are pretty much willing to kind of treat it like the common cold, flu-like symptoms that they are, and they may not be presenting as much as they are, but we're realizing as time goes on that it's not the classic triad of symptoms of fever, dry cough, and fatigue. There's a whole other constellation of symptoms that it could be, from GI symptoms to neurological to cardiac issues. So we've really adapted with that, and we've started, swabbing anything that has a symptom. My basic rule of thumb has been if you have a chart and in our emerge, you get a COVID swab, because we just don't know enough about this thing, and I don't think we can get enough swabs right now.
Is your unit understaffed, or are you working extra shifts on a regular basis? How is that work? is it a difficult balance between your work and your home? How is that working for you?
Well, it's actually an interesting story. I went to go up for March break with my family, and that was what was scheduled for the first half. And I felt a little bit unwell on day one. Luckily, I hadn't had much contact with my family because we went up in separate cars. I was going to be coming home early to work, and I developed a fever while up with my family. They were out for the day doing some grocery shopping, and I immediately got my car, wiped down the entire cottage, and called them on the way home saying that I'm going home to get tested and self-isolate. And I was sick for 8 days with a fever, and away from my family for a total of 10, 11 days. And I had 2 COVID swabs, which were negative. But symptomatically, myself and many others believe that clinically I had COVID. Influenza swabs were negative, et cetera. So for many reasons, I consider myself likely having it or have had it, and hopefully immune, and hopefully they'll come up with an antibody test in the near future, and I can get some clarification of whether that 8-day febrile cough, fatigue, no appetite illness was in fact COVID-19.
Wow. So how are you dealing with
so after that, my family came back to visit me for a couple of days when I was cleared to return to work, 72 hours symptom-free. And then once I started going back to the emerge in the nursing homes, then they decided, might as well go up north and just, there's lots of room up there for the kids and the dogs. And I'll just kind of stay down here and work as much as I need to. And I don't have to worry about getting my family sick and bringing it home, because we know from our healthcare center that there has been transmission from the front line to the home front. And so it was a serious consideration at the beginning. And I think people are getting much better at managing work and then coming home, doing laundry and hopping right in the shower when they get home to minimize the risk of bringing COVID-19 home to their families.
Right. Well, before we wrap up the medical side of our interview, in your opinion as a doctor in emergency, where do we stand? Is there have you read paperwork on possibly cures or inoculations, or what have you read?
So currently, we're still not very far as coming up with cures. There are some drugs that they're studying. It's very difficult to really make judgment on medications and their effectiveness until you do a full randomized, double-blinded, controlled study, and nothing has been done with that level of evidence. Anything short of that is just, maybe it's a trend. You don't know if there's going to be serious side effects, that the harm is more than the benefit. So there's some theoretical drugs being tried, and we'll see what comes up with that. The vaccines, I've heard anything from 12 months to 3 years. It's really, if you look at the standard vaccine process of making a vaccine and getting it tested for safety and then bringing it in and mass producing it, it can be a long time. So I'm trying to set myself a realistic expectation that it might not be a vaccine for the foreseeable future.
So a lot of unknowns still, unfortunately. Well, Craig, we're going to take a quick break, and thank you to yourself as well as all of the nurses and personnel at your hospital for risking your lives and for the greater good, and we really appreciate that. So when we come back, we'll talk.
Thank you.
How about we talk some hockey?
That sounds good to me.
Okay, we'll take a quick break. When we come back, more with Craig Donaldson.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hi, I'm Marjorie Mason, and I love to garden and to share gardening advice with other folks who'd like to learn more about gardening. And I invite you to join Jeff and I each week as we take you through the garden season in our own garden. If you have questions that are worrying you and you'd like advice, please feel free to send them to the website, and we'll answer them on Let's Get Growing only on Rogers TV.
Joined back by Craig Donaldson, a doctor and former Oshawa General, the first half of the show. Craig and I talked all about being an emergency room doctor. So Craig, let's talk some hockey. What do you think?
Sounds good to me.
Well, before we move on from hockey, you had something to tell me about Joe Biselow and Sherry Basson putting together some charity. Can you tell me about that?
Well, it's Joe Biselow. He's part of our 1990 Memorial Cup Oshawa Generals team, and Sherry Basson was our GM for Oshawa my first 2 years, and then he moved on up to Sault Ste. Marie. But we've kept in touch over the years. Joe Biselow, Paul O'Hagan, JP Davis, Trevor McIver, myself have chatted pretty much every day for the last 3 years on WhatsApp. So it's amazing the bond is still there. So they came up with this idea that they wanted to get a group of ex-players that have played with me and put together a large donation and donate it to both Lake Ridge Hospital in Oshawa, where I played for the Oshawa Generals for my glory years, and to Headwaters Health Care Centre in Orangeville, where I'm now a full-time emerge doc. So they had the meetings yesterday and it went well, and so it's really shows how the hockey community is tight, and we step up and we support each other. And I thank Joe Biselow and Sherry Basson for taking the leadership to make that happen.
Well, we can also maybe thank Sherry Basson for trading Eric Lindros to the Oshawa Generals and helping you guys win a 1990 Memorial Cup. Do you want to talk about that tournament?
Well, that would be a whole separate show. That whole season was an incredible season. We had a great team, a great veteran team to start the season. We kind of added in some big pieces like Bill Armstrong, my defense partner, Eric Lindros, Scott Lewick, mid-season, and by the end of the season, you just had this kind of feeling on the team that if you're down a goal or two going to the third, it's pretty loose, pretty relaxed. We're going to win this. It's just a matter of who's going to do it for us. So it was just a great feeling, not just the Memorial Cup, but the entire road. I couldn't have asked for a better bunch of teammates. Everybody on that team knew their role in the team and loved it. There was no animosity. We were tight. And when it came to the Memorial Cup and when it came to business, we just took care of business, and not a lot of glam. If you want to play it rough, we'll play it rough. If you wanted to play a skill and scoring game, we'll beat you at that too. So it was a great finish, double overtime with Freddie Brathwaite in the finals coming in to kind of who hadn't played, a rookie who hadn't played since first round of playoffs. So then there was is Cops Coliseum. It was two Ontario teams playing in the final. There's the Lindros buzz. It was close to Toronto. It was right in between us and Oshawa and Kitchener. So there was a packed house at Cops Coliseum, 18,373 people. I still remember that to this day. And it was definitely one of the highlights of my life.
So there was even a little bit of controversy there because the Toronto Marlboros moved to Hamilton and they were supposed to be in the Memorial Cup, but they had an abysmal season, and the commissioner said, no way are you representing at the Memorial Cup. So it ended up being your team, the Oshawa Generals, and the Kitchener Rangers, who you just played in the OHL championships. You guys were down 3-1 in the series. You came back to win in Game 7. I mean, after winning the OHL championship against Kitchener, was there much time to celebrate, or was it just like, oh great, now we have to see these guys again?
So I forget when the decision was made, because Hamilton Dukes were scheduled to be the hosts, but it was pretty apparent kind of halfway into the season that they were not going to be competitive enough to be a reasonable host. So a decision was made that they were going to be removed from the tournament, and that the 2 OHL finalists in playoffs will one will go in as the OHL champion, and the other one will go in as the host team. So as soon as we made it into the finals, we knew that we had a berth in the Memorial Cup. We played hard against Kitchener. We got down 3-1 with some unfortunate bounces. And I still remember the character of our team, because our Rick Carnaccia, our coach, came in after that bus ride. We came back, and he just laid into us and said, "You guys are giving up. If we're going to pull out of the entire Memorial Cup, and you guys run this meeting yourself," and just walked out. And we, as the captains, stepped up, and we started going on a rampage. And it was, in hindsight, it was all a coaching tactic, but it worked, because we came out and we came back and won the series in straight games with a vengeance.
So you guys were on a tear in the OHL that season, but you were going up against the Kamloops Blazers, who had an unbelievable season. I got the numbers here. They had 33 wins and 2 losses at home, with a young Scott Niedermeyer on defense and a head coach in Ken Hitchcock. Do you remember any feelings towards playing a team who you'd never seen before with such unbelievable talent as well as a record?
Well, it's so unique to the CHL, because there's no crossover in between leagues before the big finals. So you don't know how the WHL style of play is going to compare with the OHL, or the level in the queue. Are they faster skating? Are they harder hitting? So you don't know what the styles are. To tell you the truth, I was quite intimidated by, going up against Kamloops, hearing about their record, and I think they were rated number 1 in the nation. And to see them go 0-3 in the round robin at the Memorial Cup, I think was a big surprise to everyone. There were competitive games. They had a good showing, but they just didn't get on the score sheet as much as they needed to.
Exactly. It was pretty interesting. They couldn't pull out a win. I heard that their defense was a little weak despite having Scott Niedermeyer. Maybe they needed a Craig Donaldson on the back end to help them out.
Well, I think he was like a 16 or 15-year-old Scott Niedermeyer at the time. He was pretty young.
He was 16 years old.
So let's cut him a little slack. I think he did okay after that game. So
I heard he did fairly well. So you mentioned not really seeing the teams. Was there much videotape? I guess it would have been VHS back then from the other teams. Did you have anything to go on to play against these teams?
That's a good question. That's a good 30-year-old question that I think we did have some video. I think we had access to their last round of playoffs. So we could kind of, and we did have some video editing. Video wasn't as a kind of ubiquitous back then. So I think we might have had a few video sessions, more whiteboard sessions, and talking about specific players, breakdowns by position, like the defensemen, these are the guys you need to worry about. And so just the normal game prep that wasn't probably up to snuff as far as today's game prep for the players. No. Back then, it was pretty cutting edge stuff we were doing.
Is there any truth that the Laval Titan had dyed and shaved mohawks and cut the line as almost an intimidation tactic during the welcome dinner at the Memorial Cup?
Oh yeah, they looked like absolute savages, especially Gino Odjick. It looked like a a man amongst boys. It was pretty interesting.
Well, that didn't work for them because you actually beat them 6-2. So I think you were pretty good. Now you beat Kitchener in a round robin. It went into double overtime, which got you guys a bye to the finals. So between Kitchener and Laval, did you have any preference about who you wanted to face, because they were the two teams going against each other in the semifinals?
It's, in a one game, you can't, you can't really choose, because anything can happen in one game. We know the competition, the level of the competition in that tournament was, any game, any team could probably win on any given night, given a set of circumstances. And so, no, we did not have preferences. I remember we actively watched that game as scouting, but just also for interest to see who we'd be playing in the finals.
So you talk about Freddie Braithwaite earlier. Is there also any truth that you guys maybe hazed him and Lindros by having them run through the Oshawa Mall in their tighty-whitey underwear?
So long ago, before social media, there's lots of stories. I can neither confirm nor deny that happened.
That's fair. I can understand that. That's maybe as a doctor, you're giving them, doctor-patient confidentiality. So, but also with Freddie, you talked about him getting hurt, and he was a rookie. He barely played any hockey. As a defenseman, did you go back and kind of said, "All right, kid, don't worry about it. We got this"? Like, were you guys communicating, or was he in his own little world?
Well, the funny thing is about that, I think it was second period or third period. I forget when. Yeah. So at that time, the tournament rules were that if a goaltender gets injured, which Kevin Butt took a hard slap shot off the inseam of his foot and couldn't stand on it. So that meant Freddie that had to come in, and we got to warm him up. Like that was the rules, that you could just put the pucks on the ice for 5 minutes. And I remember seeing Freddie in that mask, seeing his eyes just bulging. He's normally the loosest, laid back, funny guy, and it was the first time I ever saw him nervous. And I remember being out there in front of all those fans, and just trying to butterfly some easy shots to hit his pads, and come on, Freddie, come on, buddy.
Let's go.
Come on, just soak it up, bud. And so I felt a little bit nervous for him, but I knew he was a more than capable goalie, and the performance he put on that night just basically
he took it all. He stopped 22 of 23 shots, and you guys won.
And his classy move at the end, he immediately went right down past the piles and gave Mike Torchia, the opposing goaltender, a hug, and that was incredible. That was fantastic.
Yeah. And then you guys won the first Memorial Cup in 46 years. Well, Craig, we're absolutely out of time. I could talk to you for another 2 hours about hockey, but I want to again thank you for spending time with me talking hockey, but also a huge thank you to you and all the frontline workers for all you do. That's it. That's all the time we have.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
At St. John Ambulance, we're all about community. We teach life-saving skills and provide community support through our volunteer service.